Hello, my name is Dr. Keith Eppich. I'm with Village Health Partners, and I wanted to talk a little bit today about testing for COVID-19. Early on in this pandemic, testing was very sparse and limited, and the testing that was done was reserved appropriately so for the sickest of sick patients. So as of March 24th, the CDC has confirmed that any symptomatic person in an area of an outbreak, such as North Texas, should probably get tested for COVID-19. The symptoms of COVID-19 are sore throat, cough, fever, shortness of breath. So if you're having those symptoms, please consider scheduling a televisit with one of our providers so we can assess you and deem whether a test is appropriate. The test is done through a simple nasal swab, much like a flu test if you've ever had one of those done. The way we do that is we have set up a drive-up clinic at one of our clinics in Plano to try to protect our employees. You'll drive up, stay in your car, and you'll be guided through a self-nasal swab. And that swab will be sent to the lab. Within about 2 to 3 days, we'll have an answer. Typically, it's about a 10% positive rate, meaning every 10 tests that are done, about 1 will be positive, and the rest will be negative. We at Village in the past month have done about 1,000 tests, and we've detected almost 100 cases of COVID-19. So it's about a 10% positive rate that we've seen in our clinic as well. Whether a person is positive or negative for COVID-19, it's the same principles apply of self-isolation. Certainly, if a person is very short of breath, that's when they need to consider going to the emergency room for treatment in case they have pneumonia or some respiratory failure related to the infection. There is no vaccine for COVID-19. Vaccines are specific to the virus or bacteria that it is designed for. There is a huge push right now to create a vaccine. My guess is it'll be about 12 to 18 months until this is made available. Of course, as soon as it's made available, we'll offer it to the patient population. This will be the key way to protect the world from this particular viral infection, which is so deadly and more deadly than many viruses that we have encountered. The next wave of testing that many have heard about and many patients have been asking about is what's called the antibody testing. So the antibody testing is different than the viral nasal swab. The nasal swab test that we currently have actually checks for virus in the nasal mucosa, the nasal lining. The antibody test is a test of the blood. So some blood is drawn, and it is looking for proteins that are created by a person's immune system that are specific to the COVID-19 virus. And that's important because it would tell us who is immune or who potentially can fight off an infection with COVID-19. So whereas if someone has received, say, a vaccine for polio, they will also have these antibody proteins, again, specific immune proteins that are trying to fight a future infection that the body might come in, the body might encounter. The presence of antibody to COVID-19 in a person's blood would reassure us that they probably have some level of immunity to COVID-19, thus protecting them should another wave of the pandemic hit our nation or the world. We don't yet have this antibody test, but it looks to be coming very shortly, and so we will certainly notify our patient population when that is made available. I wish you all safety these days, and please feel free to reach out to one of your Village Health Partners providers if you do have any question or concern.